Okay, hello everyone. My name is Yolanda Bunkley, and today, pretty much, we're here to discuss um, a problem that we're having in long-term care, which is urinary tract infections in the elderly. It's becoming a increase in the prevalence of urinary tract infections in the elderly. So our goal today is to discuss a way that we can help to prevent or reduce the risk of the elderly having urinary tract infections. So the aging population and demand for nurses pose a potential threat to healthcare. Urinary tract infections are the second most common cause of infection in adults aged 65 and older. The prevalence of urinary tract infections in persons aged 65 and older in long-term care range from 15 to 50%. However, did you know the leading adverse events in long-term care facilities are urinary tract infections, falls, and pressure ulcers? And these adverse events are tracked by the CMS, the Center for Medicare and Medicaid Services, and it reflects on that facility. The cost of treating urinary tract infections average over $1 billion a year. So what is a urinary tract infection? Urinary tract infections develop when germs pretty much get into the urinary system. And as you can see from your slides, the parts of the urinary system include the bladder, kidneys, urethras, and ureters. The urine passes through all the structures of this that we just mentioned. So your next slide, you will see we have called the culprit, and these are just bacteria strains that cause urinary tract infections in the elderly. The top one you see, the E. coli, is probably the one you'll be most familiar with. Basically, that happens when bile is exposed to the urinary system. In your next slide, you'll see you have the human anatomy of the urinary system, the male and female. So our target group will be the elderly. So what puts the elderly at risk? First thing is going to be their age. Immobilization, incontinence, dehydration, indwelling catheters, and also medical conditions such as diabetes, kidney problems, neurogenic bladder, and compromised patients, and those with abnormal urinary structures. Signs and symptoms in the elderly can easily be missed, but some of them are strong urge to urinate, complaint of burning when urinating, voiding small amounts at a time, cloudy urine, bright pink, red, or tea-colored urine, indicative of blood in the urine, foul-smelling urine, or complaint of pelvic or rectal pain. The elderly also present signs and symptoms such as altered mental status, lethargic. They may have a change in appetite. Some of those signs we may not recognize initially because those are not our common signs and symptoms of urinary tract infections. So what's at stake when the elderly gets a urinary tract infection? Their quality of life is decreased. They have an increased risk for falls. They have an increased risk of becoming dehydrated, a change in mental status and appetite. Sepsis and mortality can result from the elderly getting UTIs. So the game plan is, well, pretty much the role of web-based nursing in the education of health professionals.
108 needs assistance, please. She wants to go back.
The role of web-based learning in education of health professionals is growing rapidly. So working in the medical field can get a little hectic and oftentimes plays a factor in proper training and education. So we're going to promote the use of social media and internet usage in the game plan to help with these time constraints. The solution is employee education. We need to get our staff educated, especially the CNAs or the techs that are working with these patients on a daily basis. We need to get them educated, and what's a good way to get them educated is web-based learning. This will put learning at their fingertips instead of always going to a classroom and working with paper. We want to reduce the risk. What puts your patient at risk? And we want to teach that to the staff that are working with the elderly. So we talked about the solution, which is web-based learning. So who's involved? Certified nursing assistants play a vital role in reducing urinary tract infections. Nursing assistants are generally the first to acknowledge the existence of non-specific signs and symptoms of the elderly in nursing home settings. Various techniques can be incorporated into web-based learning, such as tutorials, online discussions, virtual patient simulations, and interactive models. It is estimated that 90% of personal care and long-term care setting is rendered by certified CNAs. So let's get on board. There are several web-based resources available to help improve the knowledge and care of the older adult. Improved educational opportunities can hold the key to a better quality of life for the elderly. Who else must get involved? Nurse managers, charge nurses, and the certified nursing assistants need to be in on this education. The bottom line is reducing the risk of urinary tract infections in the elderly lead to improved patient outcomes and cost savings. Are there any questions?
Oh, ma'am.
Yes. Thank you.
So I thought I turned the thing on.
Did it stop?